Quizlet CNA practice test free. Question 1. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes, every hour, every 2 hours, once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 2. What is sundowning? Increased confusion and agitation in the evening hours, sleeping all day and staying up all night, a skin condition caused by the sun, the resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 3. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 4. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 5. How often should a resident who is unable to move be repositioned? Every hour, every 2 hours, once per shift, only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 6. What is the most effective way to prevent the spread of infection? Wearing gloves at all times, washing hands frequently, using antibacterial spray on everything, keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 7. When dressing a resident with a weak right arm, which arm should be dressed first? The left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 8. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 9. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 10. Which of the following is a normal part of aging? Loss of all memory, slowed reflexes and reaction time, incontinence, constant pain. While some decline is normal, like slower reflexes, things like total memory loss or incontinence are not normal parts of aging. Question 11. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 12. What is the correct way to lift a heavy object? Bend at the waist and keep legs straight. Keep feet close together. Bend at the knees and use leg muscles. Lift with your back muscles. Proper body mechanics involve using the strong leg muscles and keeping the back straight to prevent injury. Question 13. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 14. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 15. Which of the following is a sign of dehydration? Clear, pale yellow urine. Moist skin. Dark, concentrated urine. Increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 16. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 17. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 18. What is the first step in performing any procedure on a resident? Gather supplies. Identify the resident. Wash your hands. Explain the procedure. Hand hygiene is always the first step to prevent infection before touching a resident or equipment. Question 19. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal, to provide comfort and emotional support, to discuss medical treatments with the family, to ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 20. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts.